All right. Hi, everybody. I'd like to welcome Dr. Rebecca from Lieberman Chiropractic to the Best Specialists in Rome show with Shift Physical Therapy. How are you doing today, Rebecca?
I'm doing great. How are you, Lindsay?
Awesome. I'm going to give a little intro first to tell y'all a little bit about Rebecca and why we think she's so great. So, Rebecca is a doctor of chiropractic. She has been so since 2011 at Lieberman Chiropractic here in Rome. Recently, she was voted the best chiropractor of the year for the Georgia Council of Chiropractic in 2022. And then she was also voted 2024 Peak Doctor of the Year for her relationship with interns from Life University, which is pretty awesome. She serves as a continuing education speaker for several groups, including the Georgia Council of Chiropractic, the Florida Chiropractic Society, and Dynamic and Essential Seminars. She is also an adjunct professor of the Chiropractic Science Division at the Doctor of Chiropractic program at Life University, and she's done that since 2012. So she has a ton of experience. She recently started seeing clients at the Spires, which is really cool because she's reaching out into different populations, which we think is pretty awesome. So we're really excited to have you here.
Thank you for having me.
You're welcome. All right, so I'm going to get right into it. I am
Okay.
curious why you wanted to become a chiropractor.
So, I wanted to be an optometrist. And so when people find
Oh,
that
nice.
out about me, I had actually worked with an optometrist from the age of 15 all the way through college and was about to go to actually optometry school, was accepted into a school that
Okay.
who I looked to as a mentor went to. And we had gone out to dinner before I graduated, and he goes, "Don't do this." And I went, "What?" He goes, "You are made for something, and it's just not this." He goes, "You have a gift with your hands, and it's not this." So it was
Okay.
actually my mom who worked for a cardiologist. His name was Dr. Carlton. And he goes, "Becca, well, you just don't like medicine." I said, "No, I don't think drugs is the answer to everything." And he said, "What about chiropractic?" And I said, "Well, what about it? I've never been." And so he was the one who actually told me to go shadow a chiropractor. And I was
Okay.
getting ready to graduate from college, like getting ready to walk across the stage with my bachelor's degree. And then I was like, I'm not doing it. So I shadowed Dr. Hilton in Hickory, North Carolina, and I saw these patients suffering. Like if you can imagine
Okay.
a medical room, like a waiting room, people hurting and suffering.
Oh,
And
yeah.
I walk in and he lays his hands on these people and they're getting up and they have this light in their eyes and a spring to their step. And I'm like, "What did you do? You laid your hands on them. They look like, Eeyore laying on the table when you first started, and they're running out of here with this energy." And he goes, "We connect them." And I said, "You connect what?" And he goes, that their nervous system, how the body heals and operating. And I was like, "Do what?" And he got me on to the chiropractic philosophy, which is that body is an innate intelligence. It knows how to heal and operate. And our job as chiropractors is to remove the interference and then allow the body to do its job. And for me, that was the light bulb, like, oh, this is how I can get into medicine, but it agrees with how I was brought up because my mom was
That's
a
awesome.
nurse. We never ran to the doctor all the time. We went for like
Hmm.
general checkups, but I mean, you had to have 104 temperature and have strep before my mom, who was a nurse, was like, "Okay, it's time to go." So I have a
Yep.
very kind of traditional conservative approach, like growing up. And I knew that's how I wanted my life and helping patients because I just couldn't see myself giving medicine to patients and then they have a
Right.
reaction to it. And I was
Yeah.
not okay with that. So
Yeah.
that's kind of how chiropractic was brought into my life. He
That's
told me, I
awesome.
said, "What school do I go to?" He's like, "Life or Sherman." Those are the only two. So I
Okay.
went to Life, and that was how my entire kind of story started with chiropractic.
That's awesome. I love that
Yeah.
story. What are some of the most common issues you encounter in your practice?
So somehow we have got to be known as the baby doctors. Uh,
Okay.
and we have a really good working relationship with a lot of our pediatricians. And
Okay.
so when kids get ear infections or a baby is not latching for breastfeeding, or they have that head tilt, like it's not torticollis yet, but it's getting
Okay.
there, our name gets brought up. "Well, we took our daughter to see Rebecca or our son to see Rebecca, and she's sleeping through the night now," or they're latching on. So we really have gotten to be known for children. And
Okay.
then immune system, like when people keep getting sick all the time, like with
Okay.
colds and coughs, and they go, every time we see Rebecca, our kids get better. Or I
Okay.
started seeing her and now I'm not getting sick as much. So really that is what we focus on, that family wellness care. I do get like low back pain, I
Right.
get sciatica patients, I get the crick in the necks, but
Hmm.
we are known for being that family chiropractor and that total wellness.
That's awesome. Now that I know that y'all are the baby kid gurus, um, if you could choose to stack nothing but one type of client on your schedule, like all day long, they're the most interesting to you, you're really good at it. Maybe you want to be known more for this than the baby kid doctor, or maybe along with it. What kind of person would that be?
I have really they kind of just grabbed through gum to me is someone will come after a surgery. Like they've
Okay.
already had a back fusion or they've had a neck fusion and they're still having some limited range of motions or they're
Okay.
having another issue. And when you look at the mechanics, so you can have like a disc herniation and then they take out the discectomy, right? L4. They
Right.
take out that material, but they're still complaining of some lower back issue. And when we look at the
Hmm.
x-rays, they have an uneven hip,
Okay.
or a rotated pelvis. And when you start telling them, well, if your base is uneven, isn't it going to continue to load problems in that lumbar or the upper?
Well,
And they're like, well, yeah. I said, so let's work on the base. Let's create a solid foundation so it's not continuing to do that.
I love that. Yeah, getting to that root cause of what led to
Hmm.
the surgery in the first place.
Yeah.
That's awesome. So what does the journey look like for someone to know that they should come see you and maybe not go somewhere else?
So in our office, we really pride ourselves on you need to have subluxation. So I am a
Okay.
subluxation based chiropractor. So
Okay.
to us, subluxation is a misalignment that puts pressure either on the nerve or the spinal cord, and that interrupts the brain body communication. So just because you might have low back pain, it might not be from a subluxation. That might be muscle, it might be something else. So you have to make sure that are they a candidate for what it is I do? So
Okay.
when you come in for consultation, I need to hear, do you have nervous system involvement? Do you have like the
Gotcha.
radiating pain? Is it not just dull achy? So we're going to make sure that you're a candidate for what it is we do. And so
Okay.
I think x-rays are important to make sure it's safe to go in. I do a nervous system scan that looks at the thermography, the imbalance from side to side, and we'll look at postural deviations. And
Yeah.
then with all of that, that helps me and Dr. Brian really know, are you in the right place with us? Is our
Okay.
techniques that we're going to utilize correct? Because, there's sometimes when we're not the answer,
Right.
that we might have to refer out to someone else. So, just because you want to get cracked, like some people say, that might not be why you're coming to us because, I can crack my knuckles, I could crack every bone in your body, but it doesn't mean it's going to affect your nervous system in a positive way.
Gotcha. Yeah, it just feels good, right?
Yes.
Nothing wrong with that. So kind of along that same vein, when do you recommend I consider physical therapy and chiropractic conservative care versus referring out to another specialist?
So we always talk with our clients about red flags. So
Yep.
if you are kind of on this side of a red flag, like if it's, sharp shooting pain and that numbness and tingling starts progressing too much, or they start having, decrease in reflexes or different things, I'm going to request an MRI. And then
Okay.
based off of that MRI, I have working relationships with like Dr. Webb, Dr.
Mhm.
Cowan, y'all as physical therapists, where I'm like, you know what? There's some other components to this. There's muscle involvement, imbalancing that's a cross syndrome now. And I'm going to refer them to y'all and I'm going to say, hey, do an evaluation. Let me see what you're seeing and we'll go from there. But I always kind of give my patients about a week or two. And if
Okay.
I'm not seeing an improvement, it's time for the next
Hmm.
step to figure out what other piece of the puzzle is needed.
Yeah, I think that's great. It's important to be checking on that progress always. Yeah.
Mm-hmm.
How do you see chiropractors and physical therapists working together?
We work great together. I am trained in subluxation. When people ask me, like, what can I do to rehab this? I will look at them and go, I took 20 weeks of kind of physical therapy modalities in school. This is not my area. My area is in subluxation based chiropractic. I know when it's affecting a nerve. When there's other stuff imbalancing, I'm going to refer to you. You went to school for 4 years. You're a doctor of physical therapy because that's your bread and butter. And
Right.
that's what I love about working with you is because I can say, hey, I'm seeing this. I refer them to you and you say, yep, I see this. And so when we work on the spine, you do what you do. It's a beautiful combination.
Yeah, I agree completely. It can really work so well together, like peanut butter and jelly, huh?
Yeah.
Yeah. Awesome. Let's see. What could you share a patient success story that stands out to you and highlights the importance of that comprehensive approach that you have to their care?
So I would say a recent one is I had a patient who was really having a lot of radiating pain
Mhm.
going on from like that thoracic spine. And I was conservatively like looking at the neck and the low back, trying to figure out what was going on. And I knew it was something beyond my red flag. And
Okay.
so I told her right away, I was kind of working with the MD, waiting for him, and my patient just came in tears. And she's like, Rebecca, I just can't do this anymore. And I said, okay, I'm done. So I just picked up the phone, called one of my neurosurgeons, and I said, I need a consult. I think it's something more, and it's time. Like,
Yeah.
I can't wait anymore. And she ended up having a compression fracture, and it needed some care. And he
Yep.
did his job. And in less than 24 hours, she was totally out of pain.
Wow.
And then on the same page, I can say he sends me people that like have a spondylo
Okay.
and they got that acute flare up and it's not surgical. And so
Yep.
he'll call me and go, hey, I've got somebody with that sharp shooting pain. It's not going away. It's a grade 1 spondylo. Can I send them to you? And I'm like, absolutely, because I have a grade 3 spondylo. So I
Okay.
understand what it means when someone comes in with this. It's very
Yep.
painful. And there's an adjustment that we've learned in school that you work on the bone below the spondylo.
Okay.
And it can stop a spondylo flare up, that arc that is going on. And with one adjustment, they're totally out of pain.
That's awesome.
And that's
Not too
just
many
like
other things can happen with one visit.
that, not most of the time. And I tell them, I'm like, now let's get you to a preventative point of view. Like,
Hmm.
what can we do to stabilize this so you're not going on that up and down journey?
Yeah. We call that the hamster wheel. Like,
Yes.
how do we get off of that hamster wheel? Because you
Yes.
feel good, then you do something, then you feel bad, and it's hard to
Yeah.
do.
Hmm.
That's I love both of those stories. Those are great from like both ends of the spectrum. What is one thing you wish everyone knew about chiropractic care at Lieberman specifically?
We are the family doctors. I
Yeah.
love taking care of you from infancy. I love taking care of you when you're 99 years old. My biggest thing is we say don't leave your kids at home to develop the issues that you came in with. So if you could already start getting adjusted and getting connected, could you imagine not having to come to me only when the sciatica started when you're 44 years old, but you've been adjusted since birth and you have a
Gotcha.
beautifully aligned and balanced system that you know when something's out.
That's awesome.
And so like
Love
my
that.
daughter is my prime example. She's 5 years old now and
Okay.
we've never had an antibiotic yet.
Wow.
And she's checked once a week. She's maybe adjusted every other week because she holds so well, but she just has a strong working immune system that she's in public school around all of the stuff, but her
Uh-huh.
body knows how to fight it. And people don't think about us for immune system.
Right.
Yeah.
That's a great way to look at it. Um, what advice do you have for people that are looking to prevent injuries, especially if they're active and involved in sports?
So make sure that you have a balance from side to side, not an overuse type of injury. And that's literally what will happen. So if you are active and you do get an injury, let's make sure that we get you back to balance so you don't continue to have that bad posture, bad ergonomics that lead to further injuries down the road. So when we have like all the young athletes, I'm like, get them checked because you're going to get an overuse injury, even cheerleaders to softball players, baseball. It's that repetitive motion. And just like teachers, right? Sitting down and picking up and always walking, you're going to have overuse injury that you're going to see from ergonomics of what you do every day. So get checked, get balanced.
Yeah, we see that a ton with dentists. Man, they are just always in that same position. It's that's a tough one to overcome.
Yeah. And dental hygienists right there with them.
Hmm. Yeah. Could you share any recent advancements in chiropractic treatments or technologies that you find exciting and promising?
So I just sat in on a pediatric kind of continue education, and they were really kind of talking about all the new autism and ADHD and neurodivergent type cases
Okay.
that we're seeing a lot more of, right?
Hmm.
Almost, they said 1 in 36 kids have autism now. And they're starting to really look at like a misalignment of a left atlas becoming very prominent in these kids. And they see it with overstimulation from our technology really and it's they say it's the dopamine drive. We want a dopamine all the time. So when we're online and you're scrolling and you're like, oh, that's cute, that's cute. Well, that's affecting kind of our brain and how it's
Processing.
communicating side to side. And he goes, could you imagine if they're subluxated and it continues to go down that pathway, what it's causing long term? And so he goes, we're seeing studies now where if we can get that dopamine decrease, right? Get them off of the
Yeah.
phones, get them back outside
Mhm.
like we're supposed to be. But we start getting the two hemispheres communicating, like we're seeing a huge change in not as much kind of suppressant of autistic.
Okay.
We're seeing them become more verbal and talking and not having all the issues that we've known to see through time.
Okay. That's really interesting.
Yeah.
Um, what about, so we're going to start wrapping it up. I've enjoyed this
Okay.
conversation, but parting things that you think would be helpful to someone who's considering chiropractic care, but maybe is a little nervous.
So don't watch the YouTube videos.
Right. Yeah.
Watch
For
TikTok
anything.
because we are not that aggressive. They have those microphones and they make it look very dramatic.
Hmm.
Um, we have to decide what technique works right. So if you're very like, I don't want you to adjust my neck. Well, we have something called an activator, which is a little instrument and it clicks and it vibrates the bone. Or my table can pop up and down. So you don't have to hear the popping and the snapping that you maybe are afraid of. There are different ways to adjust you. And we just
Okay.
have to figure out what is most the best technique for you. What are you comfortable with? And so if someone's like, I don't want you to do that, I don't. I don't force
Yeah.
anybody to do anything. I'm going to meet with you first, find out if you are an actual candidate for what I do. And then we're going to take x-rays to make sure is it safe to go in there and do this. I adjust you and then I send you home. And then you'll come back after you're adjusted and you let me know, like, this is how I felt. This is what
Gotcha.
I noticed. It's not a one stop, like everybody's 3 times a week. That's not how it works. Everybody is different. I have to find out what is the best, what's the best method? What do you need?
Yeah. That symptom response and feedback is huge.
Yes.
Love that. All right. So this was awesome. What's the best way for someone to get in contact with you that has a condition that you could help with?
You can reach us on our website, romechiropractic.com.
Okay.
And then you can also just call the office. Our number is 706-232-9355. And me and Dr. Brian are always there to answer any questions that you need.
Awesome. Thank you, Rebecca.
Thank you.